In our discussion of sensitivity and specificity, it appears that test results are either positive or negative. However, in clinical setting, most of test results are in form of continuous variables. In such cases, we need to establish a threshold point beyond which a person is considered to have positive results. We'll see the example of fasting blood glucose level in diagnosis of diabetes and see how such threshold point is established and how it affects sensitivity and specificity of test. We can see in this graph that we have fasting serum glucose level on x-axis and number of people on y-axis. We can see people who are healthy tend to have blood glucose level on lower side, while people with disease tend to have fasting serum glucose level towards higher side. We know specificity of test deals with people who are healthy and sensitivity of a test deals with people who have disease. We can see due to overlapping nature of graphs of two populations, it's not possible to set a point which differentiate all healthy people from people who have disease. In such situation, we need to decide a threshold point beyond which person is considered to have disease, and that result in optimum sensitivity and specificity of test. In this case, suppose we have decided to have threshold point at 120 milligram per deciliter. We can see at this level around 90% of people with disease are correctly identified and sensitivity is 90%. Similarly, 90% of healthy people are also correctly identified and specificity is also 90%. We can see still there are people in both disease and healthy group that will have false negative and false positive results. We can see the optimum accuracy in this situation is achieved at point A, which is usually close to the point of intersection of two curves. Suppose we want to correctly identify all the people with disease. To achieve that, we need to set threshold point that will correctly identify everybody with disease. Suppose we set the threshold point at 100 milligram per deciliter. We can see that all the people with disease will test positive at this level, and sensitivity of test will be 100% at this threshold point. Or we can see that around 50% of healthy people will test false positive at this point. So specificity of test will be only around 50%. So we can see as we have increased the sensitivity, it has resulted in decrease in specificity. We can see due to high sensitivity, there are no false negative results. So negative predictive value in this case will be 100%, while positive predictive value will be 66%. Let's see if we try to identify all healthy people correctly, how it affects the sensitivity and specificity of test. Suppose we set our threshold point at 150 milligram per deciliter. We can see that all the healthy people will test negative at this point. So specificity of test will be 100%. However, we can see that at this point, around 50% of people with disease will test false negative, and sensitivity will be only 50%. We can see as there are no false positive results due to high specificity, the positive predictive value in this case will be 100%, while negative predictive value will be 66%. So we can see as we have increased the specificity, the positive predictive value also has increased. Now we can see other threshold points, like we can see that above the 150 milligram per deciliter, all the test results are true positive, and below certain points, all the results are true negative. Then we have a range in which we find results that can be found in both people who are healthy and people who have disease. So we can perform tests on repeat occasions to know which side they trend, or we can combine this test with additional similar tests like HbA1c to make the diagnosis.